we're going to be discussing the legs. So I've kind of put out a similar screen to what we had last week with a few images, some lay-ins just for some of the basic information that we've already covered in some of the following weeks that we could kind of do without spending the time to set up. There's a side view, front, based off of the David sculpture, the Écriché, and then back view of the David, with some breakdowns of the knee to help us kind of as we move along. So what I'd like to do or start out with is just kind of making a basic review of some ideas of process and then how it's going to apply this week to the legs. And then we can discuss and do a quick review of the landmarks and how they're applied to the leg to facilitate the construction. So remember for this week that the muscles and their process are not going to change. It's still shape, gesture, and then perspective. I think what does change this week, make this week a little bit more difficult than last, is the type of perspective we're building on. So remember that this week is volumes that are cylindrical, whereas we did kind of approach this slightly in some of the anatomy where muscles were leaving box-like forms and moving to cylindrical objects. Now we're almost exclusively working on cylindrical objects. So that's a difficult quality in the sense that a lot of the shapes are going to be seen all the time in just a matter of degree depending on the position, and that they're having to sit around a much more kind of sleek volume than a box, which gives us an easy front, side, and back. So you're going to have to be a little bit more attentive to some of the overlaps. This week we're going to primarily be using shapes that are either triangular or elliptical, kind of sphere-like, as I think that iconically most of the shapes kind of offer either one of those two options. So there's not going to be as much kind of diversity in the shapes in the sense that I think the upper torso offers a lot of recognizable or memorable shapes for their kind of differences. So the shapes and how we use them are still going to be based on that C and S principle in the gestures. If we're looking at a muscle that is a sphere, I'm going to be thinking of one point of consistency, and what I mean is like a normal or a general existence for this shape. It's at rest or it's neutral. And then remember, this is still an abstraction, so these are maybe little tendinous representations. This is a muscle body. As a muscle will stretch, those get further, which means that our quality to a muscle will maintain that same type of volume, but thin and stretch. And so that would be a passive recording. And the active would be the muscle getting kind of moved or pulling in based on the tendons here, which are also kind of our line of action. And here we have the body kind of raising. So that's how I'm thinking about our active, neutral, or passive muscles. The perspective of each, remember for last couple weeks we've been talking about additive, or the additional volumes kind of growing the surfaces. So today that will look like this, where we're kind of adding on top of volume and then connecting it with wrapping lines. Those have been our two techniques for building muscles up, and overlaps. So here's a wrap as this muscle agrees on the surface. Here's an overlap as that muscle comes from behind and then connects. And then another one here. And so these kind of abstract exercises of just when you're doodling, start to put these things together, or think about designing forms, building on forms, is really a great exercise. And then we have like the muscles of our quadriceps to the knee. And so it's really going to be a little bit more challenging in the way that we'll see and design some of the muscles for today. So that's where we're headed as far as the basic process and overview. If we spend some time now to give a little bit more as far as our landmarks, I think that would be valuable as we build into the perspective to then include the muscles. So everything here should look relatively familiar. In the side view for the leg, this will be our anterior superior crest of the iliac spine. We're also going to be having anterior inferior today, where we're going to see the leg starting from, and that's going to be just a bit lower. Here's the top of the pelvis leading to the sacrum on the back. Down the great trochanter for the femur, I'm going to think of as starting about 2/3 of the way down the pelvis mass, so roughly in here. And I've tried to set up some guidelines so that we could have that kind of consistent for these two. I do try to think about this bone for the great trochanter of the femur pushing away from the pelvis, so that we do establish and see a sense of volume in here. So let's do these on this as well. Here's our anterior superior, which we're seeing here. However you want to design the pelvis is fine. If you're happy with the way that the box is allowing you to see the planes, that's fine. I think it's a great form as we kind of build it out here, but I'd also like to offer some alternatives, right, in case you're a little bit boxed out at this point. And that's just going to be based on your skill level and level of comfort with the material. But I would suggest that if you are comfortable and having an easy time, that you try to challenge yourself and make a new solution here to the perspective. It could be more of a teacup shape. This is a little bit more organic, and so it softens out a little bit, or some of those more difficult corners that we would use the muscle to soften anyways. So it just kind of alleviates a step. Or anything else you can think of. It could be a cylinder. You could try a number of different volumes in there just to see what fits and what is a kind of appropriate solution for your own sense. I'm going to put the anterior inferior here a little bit lower. That's where I'm going to want to think about the leg starting. And then here I'm thinking about the great trochanter of the femur starting. Bring that down just a little bit. And here's the head of the great trochanter of the femur. I want that to kind of be visible as a sphere so that I can think about how muscles are going to attach to that. And so that kind of takes us to the same on that side as well. Let's take a look at the back just to make sure that we have everything laid in. It kind of did, for the most part, put in the perspective. Here's the posterior, the move around, sacrum. Based on our line of symmetry, this is facing closer to that side, so here's our corner. This is the side plane. From the back, we're seeing underneath the volume. And then here's our great trochanter, and here's our great trochanter. So that's our pelvis all the way around. Now looking at the femur, from the side, give it a little bit of a curve, and into the actual quality to the bone, which I've shown a little bit more so in the knee, and we'll talk about that once we can lay in the femur all the way around. So here's a sphere that's ending more at a kind of triangle at the end. That's how I'm going to design the end of the femur. And from the side, let's just kind of leave it as it is, more diagrammatic, and then from there we'll build volumes onto the front and back. Underneath, what we're looking at for the tibia and fibula is I'm going to see the plateau of the tibia right underneath, so it's going to be more of a kind of angled area, and then to the side the fibula, and I might even have to bring up my foot a bit. I've made it too long. So again, I'll praise the benefits of gesture and a working procedure as I make corrections just about every step. Let's bring this up. And that's my indication for the longitudinal arch of the foot. From the front, I'm trying to show here my femur moving inwards. I'm just trying to exaggerate dynamic angle for it. And then on top of this, what I do want to show is a perspective. So let's get the whole thing here. I'm going to have this coming down and forward, as I want to be able to have this to build on. So it's okay that this is, loose or rough. It's going to be hidden. It's just a means to an end. And because it's going to be hidden, and I'm planning for that to be the case, I'm making it kind of small. I don't want the cylinder now to be much larger, maybe just slightly larger than the bone, just enough to be workable. And then this does the same. Just a rough indication. And then I tend to not use cylinders quite as much in the lower legs. I'm just going to give, at this stage, a different design for the bone. And I'll do that after we lay in these. So I'm going to say that this cylinder looks to be kind of pushing up. So just real loose. And this is going, obviously, kind of stepping forward. Okay, so just a quick diagram here of how I'm thinking about the lower leg. So we have something here from the side. This is more 3/4. In fact, I should bring this up too. So, pardon the proportion error. But from the front, the way I like to think about the knee. So here we have the basic idea of the femur on top, where we have a medial and lateral epicondyle. We have the femur coming in or down from an angle. We would then have the patella, that shield-like bone here, and then into the lower leg. So for addressing the lower leg, I do like to, again, come back to that architectural metaphor. I think about like a column. So here is the plateau of the tibia. Then we have the tibia moving down into the tibial tuberosity, which is a point like that. And we're going to see a lot of the tendon for the quadricep connecting there. So here's my point. Really important for the movement of the lower leg. So from this squared off, kind of top to the pillar, we get this move in and down. And then from the inside of the tibia, you're going to see a really beautiful, graceful curve. That's going to lead you down into the medial malleolus, or your inside ankle. Then this is going to, kind of in a wrench-like design, move to the outside. So tibia would be here, and then fibula here. And that's going to be what's leading into your lateral malleolus. So inside and outside. What I like about this as a design is that it becomes really useful for the addition of anatomy. To make sure that this surface here is curved is not only going to give you a nice lyricism or kind of fluidity to the lower leg, but it's also going to offer an opportunity to include the rhythm and connect an overall flow for the sartorius, which is one of the muscles that we'll talk about. And the way that it curves and then grabs is going to make a nice, really long S-like motion from the top of the leg all the way down to the foot. So this just kind of anticipate the sartorius building in, and then reinforce this in your tibia design from the very beginning, so that you'll be able to kind of develop and think through that type of gesture. So that's what I'd like to do, and why I'm going to be kind of pushing some of that curve in and through this area. So if I were to be a little bit more clear here, not too much. I'm going to be cautious with my landmarks to make sure I show the medial and lateral. Lateral. Here's the head of the fibula. And then curve, tibia, medial, lateral, and that asymmetrical relationship. But I generally won't come in and divide out the bones. To me, it doesn't seem to be practical for learning to construct, or in a process-based approach, and inventive development of the figure. For more extended anatomy studies, would it be beneficial? Absolutely. So here's tibia and fibula, and then high into low. So that's our, or where I would take the construction landmark buildup for this stage. The back view, we'll leave it as is, but let's take a minute to look at some of the elements here in the knee that I think are worth pointing out. And we'll return to this as we try to find and understand different cords or tendinous or muscles that are passing the knee. And so we'll kind of build this up as we go. I just want to point out some of the things that I've shown. This is, again, that plateau to the tibia. So, plateau. These are two different above form qualities to the femur. Here I'm thinking about this more rounded portion as the bone does kind of angle back. Here at the bottom. Then at the top we have the femur, or that's all the femur, but the bone pushed more so to the front here. So I try to build this sphere, kind of almost like a boat shape, with this triangle pushing, and a nice rhythm. The bone here being closer to the front. And then in between upper and lower, or femur, and then the plateau to the tibia, I'm going to think about the patella, which is something that we have talked about prior. We're going to see the patella encased in the tendon from the quadriceps above. So we're going to be seeing this encasing or over, and then tying to here. So this point is the point that we already kind of noted very briefly, the tuberosity, or the tibial tuberosity. Here from this 3/4 view, I've just given the bones a little bit more of an angular feel. Maybe our tibial tuberosity, and I'm using this kind of triangle design just to add a nice kind of simplicity to the lower leg. All I've done from this side view here is I've turned it, so this is medial and lateral. Here's our cylindrical femur, which is closer to the front, showing the curvature between the medial and the lateral, and then the placement of the patella between. And when we talk about the quadriceps, we'll come back and design a grouped tendon that will encase the patella. From the outside, returning back, we just have, or I've placed here the tibia, the fibula on the outside or lateral side. And that's so that we can look at a couple things, one of which we'll look at now, which is just to kind of sensitize you to some of the areas of straight or tension in the knee. This one being called the lateral collateral ligament, which is a ligament that you could see kind of connecting these two areas. So there's going to be a lot of harsh, straighter tendinous or ligaments around the knee. I just wanted to point out some of the more abrupt ones earlier on so that you could start to look for some landmarks around this area. So that's going to be attaching the femur to the fibula. So we're going to see something like that there. If we have it on this side, at the fibula, you would see it here. This illustration is just to show the bend to the femur against the tibia. I wanted to make sure that we had something like this, but in a gesture sense, so you can understand how that's working. And I've also included, like every week, some images from Gottfried Baumess to help us with this. What is inside here is called meniscus. and it's a cushion that will allow the femur to swing or move across the plateau of the tibia. So you can think of it kind of in here. It'll end up looking kind of more like popcorn kernels, like really tiny spheres. But the point being, for our kind of more practical approach to drawing and integrating this information is that the patella is almost always involved in an act of protection, kind of like its design. If we agree to think of this as a type of shield shape, then it's not too far off from thinking about this as an area that's protecting the exposed interior as the femur bends and the tibia stays. Right, so regardless of the stretch, that almost always occupies a centered position. So same thing here. If we think about this as straight, we can't see too much of a shift in between. So we have that protective bone even in the side view there. Okay, so that's some of our introductory material as far as landmarks, how I'm developing volleys from them, and then a few things to think about as we begin to work into the presentation of the muscles. And that's what we're going to start to do now, is we're going to work much more quickly this week because we do have a lot to get done. And then the next week, the arms are going to be spent doing 2 weeks each. All right, so what I mean to say is 1 week per part, upper and lower. What I've shown here is illustration from Goldfinger, and it is the presentation of the gluteus medius, which is one of the muscles that we're going to have help abducting our leg. So remember, abducting means to take away. So it's abductor, like aliens abduct you. So it's helping the leg move away from the center of the body. So your hip here is helping to extract or move the leg out. If you remember from last week, it has a similar design to the deltoid. Right, the deltoid was pretty similar in that we had the proximal, middle, and distal heads. And we had the middle as a multi-pendant muscle, where we had the irregular striation patterns into the muscle. This is pretty similar. So think about similar muscles having similar designs. And why that might be an overly simplistic way to think about it, that's what I'm all about, is trying to make this as easily palatable as possible. So 3, just like the deltoid, starting larger, ending smaller, and also an abductor. So it's thinking about this like the deltoid. It's kind of like the deltoid to the leg in a sense. It's just lacking the clavicle. And that might be an interesting point of departure for character, is to think about how that would work if there was some kind of clavicular or scapula-like structure in the pelvis. Here's our origin point. And so you can see it's all up, along, and underneath the iliac crest of the pelvis, or the iliac, and pulling down or inserting into the top of the great trochanter of the femur. Here we see the muscle in context, all the way up, and then pulling down, and then we see a lot of attachment to this, which is your iliotibial tract, and something that we're going to talk about a little bit more once we go through the process of including this muscle first. Okay, so let's go ahead and connect that muscle into our process, just so we get our first one, which is always our slowest, to have a little bit of sense, and we incorporate some of this review material, and then we'll dive into kind of the rest a little bit more ambitiously. Okay, so from the side view, this is where I'm going to want to start. Thinking about perspectives, I'm thinking now about first separating layers so that you can always have the opportunity to see more. Or if you get an opportunity to put this up, you could take it apart. So the shape, let's build a shape. Shape first, I'm going to say is just like deltoid, because I already remember the deltoid shape, so why make my life more difficult? This would be a shape I could use for the side, and if you remember the deltoid from front and back had that profile-like shape, so I think we could also work with that. So this would be gluteus medius side, and this would be front and or back. This in here, I'm going to think about the planes meeting up underneath. And as this connects down and towards the top of the great trochanter, the femur, as it did in our illustration from Goldfinger, I'm going to start to wrap it around. And what I'm going to try to suggest there is the idea that the pelvis is separated from the beginning of the femur by the bone pushing it away. So again, we have a little bit of space here that I want to be able to kind of suggest. This is, or point A is closer, point B is further, right, further back. So this muscle has to show that development, that movement from near to far. So having this back, large kind of elliptical suggestion of the cylinder, and then something here closer, I think helps show that. And then here's the muscle connection. And this side view, we're just kind of giving, again, more of the diagrammatic potential. Not too much of the gesture in here. Here's my overlaps, just to kind of tie this down or secure it, which is, again, reinforcing the overlap relationship to the muscle, to the perspective below. And if I see any overlaps with other muscles, which I obviously don't yet, I'd be thinking about that. Last thing is the form building. Do I see this with any additional volume? Sure. We'll give it a side plane to suggest that this has been a piece of clay kind of added on, but also to suggest that that is part of the muscle itself, right? That it does have its own volume. And that's my existing line from what's under. So there's our first piece, right? Gluteus medius, and we've put that on top. Now let's take a look at how we can understand it from the side. And I think that we do see the muscle relatively well, especially here in the breakdown, or the David. It would be here and then pulling out. This would be more of a pinch, I would say, because of where the weight is. Whereas this, I think we could see more of an S-curve because of the movement in. It looks like the leg has been brought in or adducted. So it's maybe more so stretched on that side. And let's fit it in. So here it's going to be up underneath. So I'm going to borrow the perspective line of the pelvis and then bring down my gesture to kind of cover over the great trochanter. And there I'm cheating the sphere, so that's our femur inside. I'm saying this ends around, and so I'm still thinking about the form and the development over that. So here's our muscle. Again, deltoid kind of to me looks like a pizza or a piece of pizza. I think about food, and then here this is going to be stretched, and based on the landmarks, just thinned. And now let's tie it down with some darker lines to reinforce some of the things that we've talked about, such as wrapping lines. That's under, wrapping with the surface, over, wrapping with the surface, and then can I build form? I see this as having an exaggerated sense of volume. Sure, let's see if we can develop there a front plane. Also notice the distance. Right? So here it's probably more obvious than from the side that I'm really trying to suggest this as pushing out with that femur. We're going to have muscles that need to move inside this space. Same thing, except I'm, again, like I asked you to think about last week, your transition areas. This is a C, this is an S, which is, again, depicting the gesture. The anatomy is just the kind of rational follow through on that. And And then let's see if we can find that in the back. First I'm going to carry on with my color. And making a concerted effort to now move into the more muted tones, as our upper torso was fantastically saturated. Here, I think we could see the medius pulling down, gluteus medius, and into the head of the great trochanter. So something that I would think about as kind of primarily occupying the side plane of our pelvis, just for the sake of simplicity. And then I'm going to build on my shape. So again, shape, gesture, connection. It's always the way I'm trying to think through. Or shape, gesture, perspective. Under, I have the wrap, down, connection, and then the last thing would be to understand that as its own volume. Here, maybe we'll just give an indication for it. It might be mostly covered. Okay, so that's our start. And in that we have a reassertion of bone, the placement of the muscle, and shape, gesture, and perspective. And now let's just take a look real quickly here on our écrochet sculpture, because I think that we see the muscle pretty well. It would be this. And I'm going to try to do my best to color this in as we go so that you'll have a reference. So that's the muscle we just covered. Gluteus medius. Okay, so now let's start to talk about the other muscles around the area of the hip. We'll then go into the tensor fascia, the gluteus maximus, the sartorius, and the iliotibial tract next. Okay, so having worked now through the gluteus medius, we're going to work through some other muscles in the hip area. So let's kind of just describe them all here so we can have them, we create some kind of a list. Gluteus medius, we're going to start to work now on the tensor fascia, gluteus maximus, and sartorius. And last but not least, we'll work on the adductors. So that's kind of the chunk of muscles that I want to do now. Most of these are of the hip, and the first are abductors. So taking the leg away, they'll be working against the adductor, which we'll be adding, and this will be something that will help more so with the twist of the leg, or raise and lift of the leg. So to start now with the tensor fascia, let's take a look first at the actual muscle. Oops. Tensor fascia, and that's this. So we're going back to Goldfinger. The tensor fascia is a muscle that's encased in a type of fibrous stocking. So we're seeing that starting here at or originating at the anterior superior, or just to the inside, and coming in a diagonal out, kind of past and across the great trochanter of the femur. It's latching onto the iliotibial tract, which you see here, which is kind of a long tract-like area that's connecting many of the abductors down into the lateral portion of the plateau of the tibia. So you can see how that iliotibial tract is involved in this muscle relay as a way of allowing the abductors to affect the lower leg. And so if we just had them ending here, there wouldn't be much of a pull for abduction. With through the iliotibial tract, we really get a lift on the lower portion of the leg and a great deal more leverage. So let's go ahead and design this, and then we can jump back and forth so that you'll get a sense for some of the other muscles that I have in here as well. So after this, we'll take a look at the maximus. So tensor fascia, again, to return to our method, is first going to be understood as a shape. And the shape is kind of a teardrop that's hanging in here. And so I'm just thinking of kind of an area off the end of the iliac and then down past the great trochanter, the femur, where it's going to hook onto that iliotibial tract, which we'll here design as a wrench, and we'll do that in just a second. Same shape, so I'm kind of putting this right in front of the gluteus medius, and then kind of thinking about it, pulling across the leg, and then here as well. On the David, you would find it here. So we just kind of color coding, and then here. So from the front, it's definitely going to be seen in front of the gluteus medius. So these are just some darker lines to give you a sense of the form change and overlaps. So it's going around. And then here I'm going to try to tuck it behind, right, because that's going to the outside more so. And this would be kind of the line of action I'm thinking about. Okay, so we have some ones at the bottom to look through as well. First, we place it on our sculpture as we kind of color code this figure, just for the purposes of you having something that you can kind of recall or reference. And now is also a good time to look at the iliotibial tract, as it's an important part of the connection for this. You can kind of see it in here, picking up the muscle, and the iliotibial tract is going to run the outside of the leg, ending in the plateau of the tibia. So there's that relay that allows it to kind of abduct on the lower leg. It's also strapping down quite a bit of the muscles from the outside in. That would be your quadricep, your vastus lateralis, on the outside of the leg. So what I'm going to try to think of here is, again, an iconic shape. This will change in a sense that it does not stretch. The iliotibial tract isn't going to stretch. It's really more kind of like a floating island of attachment and continuation of muscle. So we kind of think about something like this. Right? There's my wrench shape. The wrench shape to me makes sense because it kind of could fit over the great trochanter, the femur, and it allows for this to attach. And then it's going to strap down and tie onto the front at the plateau of the tibia. So that's my big shape for the wrench. Pretty important for the outside of the leg. And let's take a look to see where we'd find it on the front view here. Not going to be as clearly seen by any means. Right? We know that it has to be attaching here, as a lot of the abductors relate to that muscle, and then it's straightening the leg here. So on this outside view, what it gives you is a nice straight, a texture change or a design change from the inside, which is more curved. Here, straightening, and then down. For a shape here, what you could think about is just making the ellipse for that sphere for the wrench much slighter, and then thinking about the wrench as if you had it and turned it from an angle. And that's down here. The side, same thing. And we're just going to include it so we think about where it is, even if we're not seeing it. Back view. You can see it in here, or at least it's good to start to think about its placement. And that's a point that really does help us understand as well the outside or corner to the leg. And I'll talk about that more in a second when we get to the sartorius. But for now, we're just kind of trying to work the way around the pelvis. For our close-up here on the knee, the iliotibial tract is good to think of kind of in this area. It's something, another kind of landmark, straight or exaggerated form in the knee area that will help you, I think, make a lot of sense out of what you're seeing here. So this is going to get pretty dominant. This is the lateral collateral ligament, this is the ITT, and then we'll have a couple more that we'll look in here at, one being the tendon from the quadriceps, and then the sartorius, which is going to swing around the inside. So again, here this, here. Okay, the next one I want to talk about is, in addition to the tensor fascia, we'll obviously on the back, as we move around, have the maximus, the gluteus maximus. A couple images so that we can get a sense of this before we design it. The gluteus maximus is seated on the back of the pelvis. You can see it connecting or originating here at the posterior superior iliac spine, down the sacrum, pelvis, and to this area again of tract, the ITT. And we see all of that attachment here. So we're going to find this muscle to be connecting into that same important area that we just defined as moving to the front of the plateau of the tibia. The muscle here you could look at in a couple of different ways. One is that it has this kind of kidney bean shape. If we kind of generalize the muscle, we'll see a lot of the surface forms kind of make that kidney bean design. Another way to look at it is a couple of eggs, and this might be a more useful way for at first trying to see the gesture of those forms and how they work. This is from the Boucher book, and we just have a better idea in this slide, particularly some of the textures, striations in the muscle, and here a nice view of the tensor fascia absent, so that we see the gluteus medius and maximus in their relationship. Here the attachment, and finally from Gottfried Baumas, so that we get a sense. One thing I appreciate here especially, because it is so consistent with some of the themes for our coursework, the exploration of surface form. Right? That all of his lines, in exactly the same way we've been trying to get in touch with in the drawings, really develop all these different ideas of surface. So to find the muscle, right, to see that it connects here and follow that insertion into the ITT, but then to also come and develop the form is really kind of the same approach that we're using. Okay, so let's design that muscle, and then we'll be able to take a look at the adductors. So when I'm looking for the medius, which is our third one now, let's choose a new color. What I'm going to be looking is to use two shapes. So kind of running out of room a little bit, but let's say that for the maximus we're going to be thinking about a kidney bean shape, which could be, again, this is thinking about this as a symmetrical form, just drawing half, so the sacrum would be here. Or you can think of a butterfly design, kind of like this, and this would be symmetrical. Sacrum there. So the kidney bean shape is really just the second, or a different way of simplifying what's going on. Here, the kidney bean, or the maximus, is going to be seen attaching, just like we saw, right off the end of the posterior. And if we're going to break this up, let's say we work with more of the butterfly shapes. Here's the first ellipse. This is going more so with the direction or angle of the pelvis. And then we see the secondary shape trying to kind of curve and turn inwards. And so that's our two shapes, and we have the connection. And so there's our maximus. One important form design now that we could use that I find to be pretty valuable is the idea that many of the, or almost all of the volumes or muscles here create a form design for the pelvis, especially from the side. Looks a lot like a donut. Everything here is really kind of rounded and broad, and then starts to move in and thins as it pulls down to articulate on the kind of center point of the great trochanter of the femur. So again, food analogy. Here is the wrench, and just want to be a little bit more clear with these overlaps so as not to be confusing. And let's also consider the form lines that we're coming off, because we still want to know what each of these volumes have that's unique to them. Okay, so that's the side view. Let's go ahead and take a look at how this might look from the back, because I don't think we're going to get here a whole lot to see from the front view. Right, so maybe something, and not so much there. Just show a brief overlap. So here the Maximus is really only going to give us that much, but we're still seeing that kind of donut shape, how everything is pulling out and then down all the way around. Okay, we're going to obviously get a lot more from the back, so let's take a look here at that. Just make sure I have the same or similar color. And I think what we'll see really easily here is, especially in this one, that kidney bean shape. Right, you can really kind of find that shape well. Again, it's not one that I favor because it doesn't allow for a lot of independent study of the muscle changing, but it's useful nonetheless. So what I'll prefer to do is start more with these shapes. So I'm going to use the two. Here's one, here's the other. They're just foreshortened, so this one's a little bit smaller. And what I'm really interested in finding here is how this one can stretch now. Right, because I have the form change, so I'm going to use the second shape to show the transition from back to bottom. No pun intended there. And it's stretching, so I have to show the shape in this drawing or breakdown stretching. So that allows me now to get a pretty good idea of how I have to work with the gesture of that muscle. This one will be different, right? That one's a different type of look because the leg in this one has been raised. So now I'm getting muscle here that's starting to compact. So my egg shape or gesture shape here for this volume is pinched. So again, let's go over that with some darker lines just so we have a clear idea and separate. Notice even in my overlap lines for this is an S curve. Okay? As this leg pulls away, it has to stretch that muscle. So now this is my sculpted surface that's on top of that box. As soon as it gets to the bottom of where that line of the pelvis is, it starts to move forward and with, and now this is going to go with it. Some overlaps for the wrench. This side's doing the opposite. So what I want to make sure that I do is show the influence of the leg on the muscle. So everything here is pushing, which is causing more of a pinch shape to start to become visible here. And that would be pushing on this volume as well, which means it's going to have more of a form. The form change is going to be more significant, as it will be here. This on the other side will be the medius. So just make sure we include the idea that we could see that. Okay, so that is the Maximus. We talked about the shape, that it has a potential for a gesture, and then we've given a few descriptions for its perspective. Let's now look at the adductor, which is something that I already kind of have laid out in the PowerPoint. And again, using Goldfinger, I'm going to really take a lot of liberty with this. There's a ton of adductors in here. The adductor longus, the adductor magnus. I here just have a picture of the longus, and it's to just illustrate the point of the generalized mass I want to use. The adductor group starts underneath the leg, so the femur or the side of the femur that we're not seeing, and then connecting up to these or this point or near it. And this is going to be an asymmetrical muscle group or an antagonistic muscle group to all the ones that we've just looked at here. Medius, tensor fascia. So while this group is pulling out, this group is pulling in. And the importance there for our design and gesture is to note their asymmetry, that they work just like the lines of our figures from the very first week. So much of our muscle groups are antagonistic in this sense, so that design sense is kind of very truthful and realistic to the way that we've been studying. And have a few more views, right? Just so you can get a better sense of exactly how comprehensive, how much adductor we're actually seeing. And again, I'm taking liberty to design this as basically an overall triangle shape. Once you have the triangle shape down, it'll be a lot easier to come back in and be more descriptive inside, to break it up. Any type of variation inside is possible. But I do like to start out being more simple and then going complex. You can always develop more. It's going back to simple that's a little more challenging from a very complex state. So I'm going to start off by saying from the front, the adductor groups, our group, can be understood as a triangle. Simple, iconic shape. Obviously not going to see it here from the side. So here, this is going to fit underneath. And where we're seeing the adductors is all of this. Here we see it more pinched because the leg is brought in. Here we're seeing it more stretched, S-curve, because the leg is obviously, that's right, pulled away. So here, when I add it, that's what I'm thinking about as far as its group. Maybe that was a little bit high, so I'm going to come back on that line just a bit. And I'm just going to think about it connecting into the pelvis there on the bottom. So that's our adductor group. And here we'll do the same thing, except I want to show the idea that the leg is pulled away. So I'm going to just push the S in the design, and then I can't show it in front because it's under. Okay, now we really started to fill that area in. And I'll leave a little bit of room just for any contour on top. And let's go around making some darker decisions to show some form and overlaps. Obviously the overlaps here are to behind the leg. It's under. What this also gives a leg prospectively is really valuable. It gives it a second perspective, which is something that's somewhat difficult but really important. So we have this initial perspective. So the leg is kind of here prospectively described as moving with the femur, and now we understand all these muscles are going to be capping that as they move out, and that moves under. These are moving this way as they try to get in towards the pelvis. So here we have a kind of a secondary perspective set up by this muscle mass. And that's important to find, to make sure you're kind of pointing that out to the viewer. And again, gesture, shape, perspective. So these are our adductors. Most important theme for the design still is that you're finding their asymmetry between these two areas. Let's grab our color and see what kind of trouble we can get into with some of the other diagrams. Here, so let's just do a big wash. This is adductor. And now we have the ability to move the pelvis in, or the leg in through the pelvis, or out. Adductor. Possibly see it here, and then along the bottom of the femur. So I'm going to throw this shape down, and then we could build on it. And here, perhaps, would be stretched. But here I'm not going to be too concerned with form lines or overlaps because we're obviously going to get quite a bit built on top of this. So that is our muscle area for medius, tensor fascia, gluteus maximus, and adductors. We'll now start to think a little bit more about the sartorius because it's going to come in and kind of break up some of this and show us a plane change a little bit more. So now we're going to take a look at the sartorius, which is one of the last muscles here we have to do, and a longer muscle that is going to provide a plane shift for us. And that's here. So you can see this kind of long S that's pulling roughly from where the tensor fascia is, except towards the inside of the leg. And here on this medial view, or inside view, seeing it move all the way down from the end of the anterior superior to the inside. So right in through there. On our knee diagram, if we're looking at this section just so we get a explanation of some of the stronger surface forms, we're going to see it here. And it does really have a tendency to soften the inside of the knee. So everything else is kind of making a box surface or a sharper lined surface at our tract or lateral ligament, and this is much softer. So the longer design would be an S. And that's how I'm thinking about this as a shape. From this side, we're not going to see it. The side view, and this being the outside, the muscle would be moving down and then here, to the other side. So if anything, we're going to get, I don't know, part of this, not all, just to show kind of where it's going. From the front view, the sartorius we would see in here. So right up against the placement of the adductors. And between this and the iliotibial tract, we have a front plane. Front plane that's established that allows for the understanding of the leg as something that's more planar, as a series of front and side and back than not just the cylindrical. Also, I'm going to look for this. I find that really nice rhythm for the sartorius into the curve of the tibia. So it's something I always try to get a nice long lyrical flow. These are separate, obviously, the sartorius stopping in there somewhere, but this being the continuation of that movement, the gesture of the bone. And to show on the David what I'm talking about, this now, between these tract and sartorius, becomes a plane. And now we know very well where we're going to have to start or begin to put the quadriceps in. This side, same thing, just that now we have sartorius giving us somewhat of a corner. Okay, so hopefully that makes sense for the diagram. Now let's go ahead and include it here on the front view. So starting here, ending here. So I want to sort of set up this separation, swinging down. I'm going to have this triangular space exposed right in here because that's where we're going to see some of the quadriceps moving. And so we do have this open space. This side, I'm pulling down and then curving in and making the attachment. So not a huge muscle, definitely a long muscle, but the volume isn't going to be anything that will be hugely noticeable. Positioned it there, and from the back view what we'll see is perhaps coming down and softening this area, and here coming down and maybe softening the inside of the knee. All depends on the angle. And what we see on the back plane here, especially we'll talk about with the hamstrings, is this nice corner. Right, so that we get on the back another planar separation between back and side, between the hamstring. Okay, so that brings us right up to the quadricep group. And the quadricep group are 4, like the name, quadriceps. And if we put some design elements over here to think through the quadriceps, so quads meaning 4, we're going to look at 3, as the 4th is your vastus internus, and that is internal, right? So it's not something that we're going to readily see on the surface. What we are going to be trying to remember for these muscles is your rectus femoris, the vastus lateralis, and the vastus medialis. So I want to create a design element for these. They're all extensors, and they work together through a common tendon to extend your leg. What I'm going to begin these from is a basic tendon shape. So I'm thinking about the patella, because that's where they're going. And this tendon goes underneath the patella as it kind of also emerges or submerges the patella to the tibial tuberosity. And that's where it's pulling, so that it can extend the leg. Here, think of the tendon in the design, this would be the medial view, as having 3 kind of distinct planes. One that's taller, shorter, diagonal, and then we're back to the patella. So kind of like this irregular house shape. This tendon is what I look for to try to help place the quadricep shapes around it. And there's a couple ways you could treat it. If we start to move into our shape, over here, let's get rid of some of this other stuff so we can okay. So quadricep mass can be dealt with in a couple ways. We can think of it collectively as a big shape that we could later then come in and start to break up. The benefit of this is that here we could put in the tendon, and it's that great method of working from simple to complex. Okay, so here this mass would be situated right in here. This is the tendon that's encasing the patella, and then it's ending here so that it's going to bring your leg forward, kick the leg. But we do have 3 inside, so specifically we would want to be able to understand or at least know the uppermost, which is your rectus femoris. This is a bipennate muscle. So when we talked about the deltoid as multipennate, this is bipennate, meaning that the striations are going to go 2 directions. That's fitting into the uppermost portion of the tendon. Then on the outside, we have the vastus lateralis, which is going to be running up into the great trochanter of the femur. Here's our long angle for the house, and the short, straighter angle is for the vastus medialis on the inside. And so the reason that I'm kind of calling attention to these shapes is, in contrast to the one that I already began, is to point out the asymmetry of it all. So if you are starting with the more generic mass so that you can situate that around a volume, you would just want to, in time, come and try to work out a little bit more clearly the idea of this asymmetry. And let me see if I can point that out through a few slides. So we can come back and develop this a little bit more, but let's first look at the images that we have for this. So here we go. On the left we see the Richer illustration, and on the right the Visual Human Project. So let's point out some of these muscles. Here we see the rectus femoris attaching to the anterior inferior. So here's the anterior superior. This is where your leg's going to bend. So really important area to be very clear on. This is the vastus lateralis. You can see here, probably much more clearly here, how it is related to the iliotibial tract. It's underneath there. And so we see all of this kind of encased underneath, this being the tensor fascia or gluteus medius pulling down and connecting. It's kind of clear. This is the sartorius. So here's that shape coming down, creating the border for the leg, and then we can see that moving all the way into the lower leg. These adductors. So everything that we've already talked through has set us up for understanding what's in the middle. Here is the vastus lateralis, and again, this is the muscle that's attaching to that diagonal. So we made this plane diagonal. Here they're very short, and then here they're very straight and tall. So again, if I can understand the tendon shape, I can understand the three muscle placements much more easily. Here's the patella. You can see how it's encased in this tendon that is then attaching to the tibia. Okay, vastus lateralis, rectus femoris, and then vastus medialis. Notice how the vastus medialis's attachment point is moving up, under, and then here. Rectus femoris, the only one that isn't attaching to the great trochanter of the femur, or the femur. This is just another view from Gottfried Bommes to give you another idea. Of course, great lines of action. Here are these rhythm lines that show where the muscles are kind of relating as far as the points. And another, Gottfried Bommes for the perspective. Great perspective study of the surface forms. And this is kind of what we like to be doing. Starting to see this as having all of this great surface articulation so that we can make our understanding of the anatomy didactic enough to really start to integrate and use in our invention method. And this will be our last muscle that we'll talk about for the upper portion of the leg, the hamstrings. Let's first go ahead and situate some of the muscles that we talked about so that we don't get too far ahead of ourselves, and we'll get a little closer to do this. So let's first start with the vastus lateralis. It's our muscle on the outside. All of this. So this is the lateralis muscle. For this one, I'm going to just start to include it as a little bit good color. I'm trying to tone down the colors a little bit so you don't get nauseous from all my intense color choices here. Alright, so from the front, this is going to be a pretty thinned muscle, and it's going to be underneath this tensor. Or I'm sorry, the tract, the iliotibial tract. So I'm thinking about it up here. I've drawn it on top just so we have an idea of its placement, but I do and would want to think about the tract on top. Now, before we go too much further, let's take a look and be sure to include the tendon from the patella. So here, this is going to be the diagonal, comes out, grabs up, just shorter, and then straight. Comes over, kind of encases the tendon, or the patella in the tendon, and then connecting here. Okay, so now we have the ability for this muscle up on the upper leg to utilize and pull. And so it's pulling on that, which in turn would straighten your leg. So the shapes, here we have this one more or less attached. It's pulling it over. As far as the height, if we're looking at the different kind of asymmetrical or symmetrical positions for these muscles, this one would be in the middle. And let's go ahead and show this on the side, and then we'll do the vastus lateralis, which is very low relative to this. For this side view, the muscle is very wide, so it does take up quite a bit of the side of the leg. And here, this is a better view to show the vastus lateralis underneath the iliotibial tract, which we didn't do as good of a job there, but not to worry, we can just put it back on top. So this is really where I'm thinking about the muscle placement in a general kind of analytic sense, and let's design something for the tendon from the side. On the side, I think I'm going to go more with something that's kind of triangular, just to show how it's grabbing, pulling over, and then connecting here. Now a few overlaps. This is going to be under, under, under. And let's look at some form. Big muscle. This is pushing down on it, so it's going to change the surface to be lower. Oftentimes you'll see a halftone or kind of a shadow area there. That's the tract pushing down and creating for a surface transition that causes value or shadow to collect or become more noticeable. And do we have any others that would require that we show? Sure, we could show on the back view as well. And I think that we do see it rather well here. It would probably be this shape. Easy idea of it there. I'm going to use this to help present the side of the leg. And so this is where I'm thinking the shape is. I'm always going to draw through, especially with these shapes in the legs. I always want to think the whole shape. And this is something that's going to the front. And so what I'm going to do to help emphasize that from this view is not only to give the overlaps their due, showing all these things and their relationships, but what I'll generally do when working with the knee is start to, towards the bottom, box it. Really angular form at the knee. So here, either with the help of the iliotibial tract as it's going to the front, or the hamstrings across in the back, you can set up a really kind of nice system of planes here. And I'm just going to bring it up because it may have gotten a little too low. Oops. And then we can build down the knee and include the hamstrings, and we're just about done for the back view. So what we would still need to show in through here is lower leg. And do we see it here? Yeah, we would see the, okay. In our sculpture, here's our vastus lateralis, and you can see how it does have this position underneath the iliotibial tract. Don't see it here. In this view, we've already kind of drawn it out. So that's our vastus lateralis. Here it would maybe just give us a curve, because we're only seeing it here so much in profile. And then that blue line for the track would be behind and on top of it. Okay, so our last two to do for quadriceps will be rectus femoris, vastus medialis. Okay, so the last couple quadriceps that need to get covered here is the rectus femoris and the vastus medialis. So let's go ahead and do that. Here we've already kind of included where the rectus femoris would be related to the other quadriceps. And all I'm doing here is just kind of working my way over from the lateralis over to the medialis. Vastus lateralis will be next to the rectus femoris. Rectus femoris is going to have a slightly different attachment point though. We're going to see the rectus femoris kind of coming through here, and it's going to be one of the, or will be the highest quadricep, the other two ending here and then there respectively. So it's going to give us a nice asymmetry, and this is attaching there to that anterior inferior. And here. So let's take a look at our pec real fast, and you see the nice large shape here. Again, this was that bipennate muscle that we talked about, so that we have the two going either way in the striation. Here, nice shape for it as well. Going down, sitting highest out of that quadricep group. So there. Okay, so if we add it on, we're just going to remember that shape and then make sure that it's matching the perspectives. So here, I really want to push that line to show the volume of the leg, and then I'm going to go ahead and lay in some kind of a lip shape, which I can then train or kind of build course into having volume. So here's the shape, right up against lateralis. It's going to be the tallest one. And just darken a little bit so you can have it stand out a tad from the sartorius. On this side, we're going to see it here, just kind of more so in profile. And so it's starting high and then pull down to the top of that quadricep area. And so that's our position, and let's give it an overlap. So somewhere in here, sartorius behind that, and then here I'm going to make sure that my lines indicate its perspective placement. Okay, so important here is that this deals with volume. Then I can go over the lateralis and start to get kind of a carved out quality for the upper portion of the leg. But again, this is really part of being attentive to the analytical qualities of form, is starting to kind of work with some of these lines, developing the overlaps, and then on the inside we're going to see the vastus medialis. So medialis is going to be this one. So in the quadricep group, we've worked from the overall shape, which you can put on volume, to more specific shapes that can either be broken outside after having established this, or working right directly, either one. And what we see for the medialis is this shape. So it's part of what is kind of coming in front and separating on top of the sartorius. And we see it as that lowest. So this side, let's keep our egg shapes a little bit clearer. That lowest portion. So it's all the way up inside, coming down, going over, and then this is what's fitting into the straightest portion of the tendon. We described it as that kind of irregular looking house shape. Here we're leaving shapes. And so another way of drawing would be to think of these shapes and start to work with a gesture based on the shapes, and then tying them down with the wrapping lines and T-overlaps later. Not a bad way to work at all. Here's just more of the overlaps. This side, just trying to give you a better diagrammatic sense of kind of where things are and how they're working in space. I'll bring that down a little bit. Sartorius is going to here split the difference between the vastus lateralis, medialis, and the adductor. And so you really get that kind of split in through there. And that's basically the quadricep group. What we could do is kind of come around to the back and see if we're kind of end up finding or seeing anything there. But that's the kind of essential basic way that I would break that down. I'm not going to see it from the outside. Inside, perhaps we might see a little bit of the medialis, kind of in here. Just a tad. So that would be, and then we could probably also find a little bit of the lateralis here. Just give you more of a curve to the outside of that leg. Medialis on the écrochet or the sculpture would be on the inside, here. So that's how we're seeing the medialis, vastus medialis in here. Going up through and then ending in there. So really important for the quadricep group is that you do keep that sense of asymmetry intact. This, so we go dark line to this, and now the nice curve to the inside of the knee, straight here, and then we're going to see some of the hamstrings behind there moving into the leg. So I'm doing my best here to emphasize the rhythm and the form. This is a good place to think about the tendon. Right, so all of the muscles off of this quadricep group are going to grab into the femur. So you can think of all these kind of connecting, or grab over the femur into the patella. Patella becomes kind of encased in this tendon, and then we see this attaching down into this tuberosity of the tibia. So if we look at that on our knee down here, you're going to see a big, coming from the quads, encasing, and then ending here. So it kind of ends up looking very much like type of box. So just another surface form here that's going to be an important area to think through. This would be going up into the quads. So sometimes we have, or some people have a little bit of difficulty with the knee. I think the best thing to do is always just describe it as planar as possible, and then bring simply the major contributors around it, which I tried to show. Here, again, our shape was the diagonal, the straight, and then pulling over, and then this is that volumetric tendon now. Vastus lateralis, rectus femoris, vastus medialis. So we've done most of the front of the leg now. What we can do is take a turn and start to look at some of what we see on the back, which we're going to keep pretty simple as hamstrings and a very edited or basic way of thinking the hamstrings. So jumping to the PowerPoint, what we'll see on the back here is the basic mass of the hamstrings, and that's how I want to talk about them, is really just as a common mass. But we have a semitendinosus, a semimembranosus, a biceps femoris, long head, and long head is with the short head. So in total 4 muscles, but we're going to really try to just break them down into a simple shape for time constraints and subject constraints. This, the analytical figure, is the, and I've said this a number of times, but just to be clear, is the subject, not so much an anatomy class. And what I'll do as a common mass is just collect all of these 4. And this is what I'm thinking of summarizing, or kind of creating an abstraction for, is the body of the muscle, and then at the bottom I'm going to kind of just define these as more tendinous forms. And I'm going to simplify this as two long kind of triangle shapes that are going to tie onto the tibia and fibula respectively. So again, here's that mass. So I'm thinking of it's underneath the maximus, attaching to the pelvis, split down the center, and then the two tendons pulling to either side. Inside, adductors, outside, vastus lateralis, and iliotibial tract. Here's just another view of that same idea, so you can get a sense for what it is I'm summarizing here. Big egg shape, and then I'm going to make two legs essentially for that egg-shaped mass, which are going to become tendons. And then I included some images of the knee that we'll come back to and look at in a second. So let's go ahead and look at this. First starting with the back view. So the hamstring mass that I want to start to see from the back will be, again, that basic shape. Big egg shape, and then I can split it in half. With the two legs. So just like that. One going to fibula, one going to tibia. And I'm going to try to put that right inside or underneath some of the information I have. So on this one, it's all of this. So I'm simplifying to the egg shape, and then here these two great legs provide me with the corners for the box in the back. This side would be stretched because the hamstrings are really like the bicep for your leg, and they're going to help to flex it, which involves pulling it up to the right angle, or making your leg a right angle or a pinch. The quadriceps are stretching, and so that's where I'm going to be thinking about bringing the two. And on this side we would see something similar. It's stretched because the quadriceps are active. One. This is now in front of the sartorius. And again, we're placing our big sculptural mass, and then we'll come back now or in a second with our darks and start to tie stuff down. Am I going to see it from the side? Absolutely. So we're going to see it underneath, and it's going to give us a little bit of contour. It's underneath the vastus lateralis, and then we're going to see it tying here. So that's our last kind of surface form. We're going to see it on this side. Maybe some tendon at the bottom. And here, we're going to see a little bit. So I try to keep this right leg just more shape-based. Now, let's go through and clean this up with some T overlaps and darker lines. This is behind, but showing itself in the front. This is obviously behind, so here the leg starts to look like a very shallow landscape. This is behind. So again, these are general diagrammatics of where the muscles are, kind of what they do, what they're involved in. The goal for the homework this week is to really see these in different positions. Try different drawings, try different extremes, try different movements. I don't really have time in the context of the lecture to draw out every or a number of different positions. I feel it's mostly probably beneficial to give you the kind of nuts and bolts mechanic information, and then through homework have you try out some views, and then I can help you kind of address what you may find to be confusing or bothersome about any particular activity or series of activities. And so here I'm going to get a repetition of the volume. This moving with the leg, this moving up, and then into the knee. Which you can see I've used the quadricep there to really kind of box out. And that is most of the stuff on the upper portion of the leg. And so I think we can have a pretty good idea of the surface volumes kind of in through here. What we could talk about to end is just some of what I like to use or see on the front of the leg and back. Right? So what we're not going to do is go into all of the complexity of the front of the leg, as I think that's too much, and there's not enough time to do it. It would be a good subject if we were to, in the future, maybe do a lecture on the feet or a workshop on the feet to spend more time thinking about the shapes. But we have the tibialis anterior. There's a number of muscles in there, such as extensors, extensor hallucis longus, flexor digitorum longus, peroneus brevis, so tons of muscles. Peroneus longus, or the tibialis anterior, are muscles that we may see in the front. But again, stuff that I think is just way too much for an analytical figure class. So instead, what I'm going to be looking for is, as far as the design of the lower leg, to keep this as a straighter area for now, and then what we'll do is design the soleus and the gastrocnemius, which are behind it. So the soleus is going to be a muscle that will grab onto the lower leg. The gastrocnemius is one that will connect to the femur. So that's the difference between the two. And let's see, we could start back here. So this is our tibia, our fibula, ankle, tibia, and then we have the heel block at the bottom, or the calcaneus. This is important, as this is where we're going to look or see the soleus and gastrocnemius ending, as this block. So soleus is a muscle that's starting here and kind of pulling down. And we get this nice large Achilles tendon at the bottom. That's going to be something that you'll see common to both. But only this, soleus is only moving from tibia to heel. Right, so it's something that's more specific to the lower leg and under. Right, so we're going to see this kind of pulling down and through here. Gastrocnemius is going to be a little bit larger on top, and we're going to see that connecting into the femur. So let's get a new color for that. What I do for kind of an analytical conception of this is tuck it in between the H that's created on the back from the hamstrings. And now this is going to sit on top and here. Now the Achilles tendon in the back is an important area to provide an attachment, and let's lay that in. The design is that you will see the gastrocnemius on top a little bit more clearly as far as some of the muscle striation and development. That you'll see kind of like a peace sign inside here as it overlaps and connects to the femur. We will see the soleus underneath, kind of creating an overlap, and then down. And then the ankle. So we still have that asymmetry even in through the ankle there. And that's pretty much how I like to think about the qualities of the lower leg and the muscles from that back portion. To make a kind of simple shape from them, maybe we could put them up here, or possibly just next to. I think about a egg shape with another egg shape underneath. That's the gastrocnemius and the soleus. Gastrocnemius has these two attachments at the top, pulling to the femur. It's split, peace sign shape, and then we start to see the tendon pulling down. So that's a back view of a simplified way of kind of conceiving through or working with this muscle. And from the front, first let's do the side. Here, gastrocnemius would be continuing up and connecting, and then we're going to see it pulling down. Soleus under, only kind of tibia to heel, and then here's our Achilles tendon. And from the side, that gives us a pretty nice conception of the leg, I think, as something that's rhythmic and very simplified into shape. So here's the big major masses. A nice way of thinking through the anatomy that really lends itself to that, since that's our main goal. This could later become more complex by thinking more of the muscles on top. All the shapes, proneus, tibialis anterior, flexors, and into the foot. But for now, a good starting point to think about the larger mechanics. From the front, this is really what I'm drawing, this shape from the back. So paradoxically, from the front of the leg, I'm really still drawing the back, especially at the bottom. And what I look for is this, that in the lower leg, from behind the tibia and fibula, we see the soleus and gastrocnemius. We see a little bit of the reverse here, and that we will see the, in this sense, the soleus in front, the gastrocnemius behind. So this is how I show it. What you'll notice here is that I'm also keeping the angle of the soleus very high on the lateral, and then lower on the medial. So think of it like a C-curve and then a triangle. And the gastrocnemius is behind the soleus. So here what we kind of get is like a little landscape for our overlaps. Let's be a little bit clearer with those. This is behind, that's in front, this is high, this is in front, that's the soleus, this is behind, that's the gastrocnemius. So think of a little landscape. This is the tibia, fibula, and this would all be filled in with stuff later. Ankle. So nice asymmetry, hopefully, in our legs all the way down. At least that was the goal, was to encourage that type of thinking. High, low, high, low, high, low, all the way down into the ankle. On this side, if we're just thinking about shapes, sphere, behind, oops, high, curve, and all the way down. So that's the muscles of our side, front, inside, back. Here we could maybe just quickly lay in the back of this leg. I don't want to bore you guys too much. This has gone on a longer lecture this week. Here's a big shape for the gastrocnemius, soleus, and this side I'm just basically thinking the shapes a little bit more. Then we're seeing the tendon pull down, and here lifting up. And so it's helping that calcaneus or heel block start to lift. Let's identify it on the guy here. So you can see all the muscles that I'm kind of thinking through. Tibia here, and then here's our shape. This is the gastrocnemius, in front is the soleus, and then we're seeing that information back here. And so we are leaving a lot of complexity out of the front for another day. And then the same thing. Or hopefully with some of the stuff that we've gone through, just understanding the shapes and the way of designing anatomy could make it possible for you to be able to understand and design that for yourself with a little bit of kind of study and consideration. And I think that is it. So we have finished our analytical run through on the leg. The last few images that I've included in the PowerPoint are breakdowns of the knee, and I've included these for you to have. I'll also put them on the blog to give you some different perspectives on what the knee is doing, how it's working. It's all stuff that we covered. I'm just trying to give you imagery here to reinforce it. So please find this on the blog, or I will provide it for you upon request so that you can have some additional information to kind of look through. This is that last muscle that we looked at. Here is the gastrocnemius. Here is the soleus, which you can see underneath, and how it's grabbing onto that tendon on the sides, which is the Achilles tendon running into our heel block. From the side view, the stacking of one on top of the other, and then we have the muscles that we've unfortunately not had time to complete. So I hope that you found this week to be informative, if not somewhat enjoyable. The legs are pretty difficult, so please make sure that when you're doing your homework that you do your best to try to follow in the same type of developmental sequence that we've covered, and bring all the questions possible. So again, thank you for your attention, and I look forward to seeing your work for the week.